Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, if you've been listening in lately, you have heard me talk about our Gold Lactation Online Conference 2024, and it is coming up. It's right around the corner. We are so ready for this. Let me tell you, bring it on, I say, bring it on. And here today, we have our keynote presenter, Jacqueline Kincer. It is my absolute pleasure to have you here today. I'm so excited about you coming to bring this topic, of course, diving into the nuances of clinical sucking skills, bridging infant oral function, and breast physiology. Welcome back, Jacqueline, to Gold. It's so good to have you here today.
Oh, thank you for having me once again, Fiona. It's an absolute pleasure to be speaking for you. These conferences are always wonderful, and it's an amazing opportunity to get to reach so many people around the world.
Yeah, absolutely. And I think people are so excited. If people don't know already, they should head over to the website at goldlactation.com because your presentation is going to be free and open access to everyone everywhere. So wherever you are in the world today, you'll be able to register. So all you have to do, it's absolutely free to register. Just pop your name and email in. And that will give you access to the live attendee, as well as you can listen to the recording, share it with your friends and colleagues. This really is a presentation not to be missed. And let me tell you why. I'll have to say, Jacqueline, and you know this already, you know this, but not only is Jacqueline an expertise in this area, but clinical sucking skills is, I would have to say, probably the most popular topic that comes up at Gold. It is hot and folks just always want to be able to get it right. They want to talk about it. But not only that, there's a lot of controversy in our community still about what exactly is sucking skills. What are you going to be sharing with us on the day, Jacqueline?
Oh, yes, I'm very excited. What I'm going to be sharing is, that there are basics, right? There are things like the quote unquote latch. And then, there are, the idea of a baby sucking on a finger baby or something like that. And I think those are really limited definitions that really don't serve us well as professionals, but certainly not the families that we serve. And there's a lot that is going on in that baby's mouth, that interaction with the breast or bottle or whatever it may be, where we don't get to see it unless we're using an ultrasound or an MRI machine or something like that. So how can we tell what's going on? How can we tell that what's happening, during that sucking process is optimal, efficient, correct? Is there something we need to change about it? And so if you can know those things, then you can make a really big difference when it comes to breastfeeding. So whether that's, pain that the mother is experiencing, whether that's, complications, issues that baby's experiencing because they're swallowing air, they're struggling to get enough milk, all of those things, really, if we can use the foundation of those sucking skills to then look at what else needs to happen or how does that affect the breastfeeding relationship going forward, we can make a huge impact on people meeting their breastfeeding goals and seeing more success with breastfeeding rates.
Yeah, absolutely. And I think that's the key. I mean, we want folks to be successful. That's just the bottom line. That's why we're in this business, in terms of business of babies and, being successful. It's one of those things in our community today that I feel that, there is a lack of knowledge. There's a gap for sure in that nuanced behavior, that it isn't just about, getting the baby on there, that we really need to watch the behavior. I know you're going to be talking a little bit about that, what to look for. You've got some great videos, concepts that you're going to be sharing with us as well. Tell me about the things that you have been loving learning or relearning as you've been going through this process, Jacqueline.
Yeah, I've taken a lot of different courses. I've worked with a lot of different clients, and I've had a team of lactation consultants that work with me, which has been amazing. I've collaborated with other providers, and I've gone to the extreme of learning all of the ins and outs and then trying to apply that in clinical practice. And where I'm at now is this trying to create simplicity with it.
Mm,
So we don't have to know and assess every single thing every single time that we're with a family. It's being able to rather quickly discern what it is that we need to observe and assess and look at, and what's sort of the, in startup culture, there's this idea of the MVP, the minimum viable product. So how can we do something like that in our care? Because you have this short window of time with somebody, whether it's 15 minutes, whether it's an hour, maybe it's 3 hours if you're doing that, but it's still a very short window of time. We're looking at maybe one feeding in that period of time. What can we accomplish that's going to make a difference for them in that time? If we're too focused on, little things here and there about a sucking skill or something, realistically, it shouldn't be that hard, right? And it is very hard for families, but
Mm,
there are ways that we can take all of that knowledge and then distill it down to what are the things that this family needs from me right now? What are the things that they need to be successful or to get some improvement to get to the next step until the next time that I work with them or the next time they see a provider. And I think, it's important to learn all of those technical skills, but then how do we bring all of that together to create success?
yeah, absolutely. I think, you hit it right there for me, just talking about breaking it down and distilling, that knowledge and meeting the family where they're at. I find today there can be so much information trying to get it into a session with our clients. Our language is very important. Can you tell me some of the things that you have seen in your community where language has either become the barrier, where misinformation or just information in general has not been helpful?
I will say there's been a trend I've observed for a long time where when we are overly technical with our knowledge or we use certain naming conventions for things, that creates the sense of an absolute for families. So, for example, saying that a baby has a class 4 tongue tie, or saying that they have an anterior or posterior tongue tie, or saying that the baby is experiencing aerophagia, whatever it is, right? And then you explain what those things mean, but it's still, I don't think parents are looking for a definition. I don't think they're looking for a diagnosis. I think what they're looking for is, okay, now what? Because I've had so many families that will say, so and so, whether it's pediatrician, whoever, another lactation consultant has told me this is going on, but what do I do with that information? And it's
Mhm.
really, it, we can, I don't, I don't really spend a lot of time on my clients telling them the things that I'm charting, which is, you know, exactly what the tongue is doing, with its lateralization, its elevation, its extension, and the baby's, suck, swallow, breathe count, right? Like those are things I chart. Those aren't things I really need to go over with the family. What I need to go over with the family is, here's what I'm observing. My favorite thing to do is give them a play-by-play with the feeding. And as we're
Mm,
doing that, if there's adjustments that I feel like are worth making, whether because I think that's the right thing to improve things, or I don't know if it is, but let's try it and see if that makes
right.
a difference. And then getting that feedback, it's an interactive process. So talking them through it and helping them understand, because I think my goal, and I think what a lot of our goals should be, is we're not going to be there every single time that they breastfeed. They have
Hmm.
to be able to do this on their own. We can't handicap them by not helping them get to that point, right? So, I don't do a lot of hands-on, if that makes sense,
Right. Yeah,
right? I want them
absolutely.
to be
For
the hands.
sure.
So I'm
Yeah.
happy to guide. I ask if they want me to guide, but for the most part, I try to, make sure that they're understanding what I'm saying so they know how to do this on their own going forward.
Absolutely brilliant. Thank you so much. I mean, that is clear, but I know that we're going to need more time with you, Jacqueline. We're going to need to, come together and make sure that we can do some knowledge translation in all of what this looks like as well. But I'm really looking forward to of course, you're going to be here chatting with us very soon. For all of you listening in, once again, don't forget to head over to our website, goldlactation.com. Check out all the details. Jacqueline Kincer is one of our keynotes that is here this year. And you will be able to sit with Jacqueline and myself in a live presentation. And of course, we'll have that live Q&A. We'll be sitting together, really celebrating what an amazing community this is and how we can take things to a whole new level. Thank you again, Jacqueline Kincer, for being here with me here today.
Thank you, Fiona.
Yeah, and thank you to everyone who tuned in today. Again, thank you for joining us, and we will look forward to seeing you all very soon. Bye-bye for now, everyone.